All right, future nurses, let's talk about one of the biggest, most tested drug classes you're going to see on the NCLEX, beta blockers. I know pharmacology can feel overwhelming, but trust me, by the end of this, you are going to feel so much more confident about these meds.
So let me start with a weird question for you. How can literally laughing out loud help you master an entire class of heart medications? I know it sounds a little crazy, but stick with me here because this one little trick is about to become your new best friend for pharmacology.
And here's the secret. The LOL mnemonic. If you see a generic drug name on your exam and it ends in LOL, you are looking at a beta blocker. Think metoprolol, atenolol, propranolol. It's the absolute easiest way to spot them. So from now on, just remember, beta blockers make you LOL. Got it? So here's our game plan. We just nailed the LOL trick. Next, we're going to break down how they work, who gets them, the 4B warnings you absolutely have to know for safety, and then we'll finish with your nursing playbook. Let's do this.
First things first, how do these drugs actually do what they do? Well, the easiest way to picture it is that beta blockers are basically brakes for the heart. Now, the textbook term is beta-adrenergic antagonists. All that really means is they block the effects of stress hormones, like adrenaline, that make your heart go into overdrive. So the heart ends up beating slower and with less force. And what does that do? It lowers the heart rate and it lowers the blood pressure. Brakes for the heart. That's all you need to remember.
And check this out. This Mnemonic image is like a visual cheat sheet for everything we're about to cover. You can see these little characters that stand for things like breathing issues and low blood sugar. We're going to come back to exactly what they all mean in just a minute.
Okay, lean in for this one because the NCLEX loves to test this. There are two main types of beta receptors you need to know, beta-1 and beta-2. And the memory trick is so simple. You have one heart, so beta-1 receptors are in the heart. You have two lungs, so beta-2 receptors are in the lungs. Blocking beta-1 is what lowers the heart rate and blood pressure, but blocking beta-2, well, that can mess with breathing. This difference is absolutely critical.
So, now we know the how, let's talk about the who. Who are the patients that are actually taking these all drugs? What are the main reasons they're prescribed?
You're going to see them for a ton of different things, mostly for cardiovascular issues, right? So high blood pressure, chest pain, and chronic heart failure. They're also super important for protecting the heart after a heart attack, getting irregular heartbeats under control, and even for some things you might not expect, like preventing migraines or treating glaucoma.
Okay, everyone, listen up. This is probably the most important part of this whole review. If you take away one thing, make it this. For the NCLEX, safety is king, and these are the 4 biggest, most dangerous things you have to watch for with beta blockers.
To help you lock this in, we're going to use an amazing memory trick from simple nursing. It all comes down to the number 4. There are 4 Bs that you just have to know. 4 critical warnings that are prime material for an exam question.
And here they are. The 4 Bs are bradycardia and low blood pressure, breathing problems, bad for worsening heart failure, and blood sugar masking. Let's break down exactly what each of those means.
First, bradycardia and low blood pressure. Remember, we're putting the brakes on the heart, so if those brakes are working too well, you get into trouble. If the heart rate is less than 60 or the systolic blood pressure drops below 100, you hold that drug. Do not give it. That's a classic NCLEX safety rule. And you also got to teach your patients about getting dizzy when they stand up. That's orthostatic hypotension.
Second B, breathing problems. Remember those beta-2 receptors in the lungs? Well, if you give a non-selective beta blocker, it can block those receptors and cause the airways to tighten up. That's called a bronchospasm. So here's the bottom line, the huge safety alert. Never give non-selective beta blockers to patients who have asthma or COPD. And as the nurse, you need to be listening for any wheezing.
Third, bad for worsening heart failure. Now, this one can be a little tricky because we do use beta blockers to treat chronic stable heart failure. But if a patient is in an acute flare-up where their heart failure is getting worse, these drugs can actually be dangerous. Your job is to be a detective. Look for signs of fluid overload, new swelling in the legs, crackles in the lungs that sound worse, or sudden rapid weight gain. You see those? You report them immediately.
And our 4th and final B, blood sugar masking. This is a massive safety issue for any of your patients with diabetes. Usually, when blood sugar gets too low, the body gives off warning signs, right? A racing heart, shakiness, feeling anxious. Well, beta blockers can hide or mask those symptoms. The patient's sugar could be dangerously low, and they might not even feel it. The takeaway here? You have to teach them to monitor their blood glucose super closely.
Okay, so we've got the warnings down. Now let's turn all that knowledge into action. This is your nursing playbook. What do you do before you give the med, and what do you have to teach your patient?
Before you even think about handing that little cup to your patient, you do two things every single time. Number one, you check their apical pulse for a full minute. If it's under 60, you hold the med. Number two, you check their blood pressure. If that top number, the systolic, is under 100, you hold the med. That's your safety check. It's not negotiable.
And finally, your patient teaching. This is huge for keeping them safe at home. First, they can never just stop taking this medication suddenly. That can cause their blood pressure to shoot way up. Second, teach them to change positions slowly to avoid getting dizzy and falling. Third, make sure they know what signs of worsening heart failure to look out for. And last but not least, if they're diabetic, drill into them how important it is to check their blood sugar often.
Okay, so let's put it all together with a quick NCLEX-style challenge. Your patient's taking metoprolol. You check their pulse, it's 52, and they tell you they're feeling dizzy. What is your number one priority action? Think about our 4 Bs. Think about your safety checks. This is exactly how they'll test you. The answer? You hold the medication and you call the provider. See? You've got this. You just aced it.